Welcome back, Sweden, to your Caribou Data Science channel. First of all, I got some fantastic news for all of our. We hit the 300 subscriber mark within the last 24 hours, sometime on Thursday night. Okay, that is fantastic news because all those 300 subscribers are because of first your subscriber, your subscription, and the fact that you every time you share this video with a friends or family, that's the potential for another subscription. That's how we got to 300 because of your shares and your likes and your subscriptions. So thank you so much, Sweden, for all you've done for the Caribou Data Science channel. Now, of course, we need to remind ourselves that Sweden only records COVID-19 data for Tuesday, Wednesday, Thursday, and Friday, but instead adds Saturday, Sunday, and Monday's numbers on the Tuesday numbers, which produces a big spike, and it makes it very difficult, or not impossible, to understand what the actual daily numbers are. So in response to this, we're only going to focus on the trend, okay, the trend, and that means rather than focus on daily numbers, we're going to focus on the trend, whether the numbers are trending up or are they trending down. So let's take a quick look here. Okay, so these spikes, let's just zoom in. You can see exactly. You see these spikes are Tuesday numbers. And look how far they are above the rest of the weeks, and that's the problem with this method, because we can't really be sure what the actual daily numbers are. So again, we're not so much concerned with the y-axis values. We're concerned with the trend, and you can see for a pretty good period of time you had a trend down in cases, but here the last few weeks your cases have begun to increase again. Okay. What about and this of course is the 28-day moving average for deaths. So you can see for a 28-day period ending August the 5th, you were averaging 674 cases per day. Okay. Now look at this. First of all, look up here. Again, the volatility. Look how far you've come from back over here, all the way down to here. Let's take a closer look here. So at this point, you're under back over here. You had 4 deaths, but here those numbers have been declining back over here. So this is very good news. I'm not sure what you're doing, vaccinations or what, but your death numbers are still very low, and that's what's important. Because in America, the Washington University's Institute for Health Metrics and Evaluation says that the single best measure of the spread of a pandemic is daily deaths. So don't be misled by talks about increasing cases and increasing hospital usage. Okay? I mean, how many people who were hospitalized for COVID-19 really needed to go to the hospital? How many of those people who were hospitalized were in risk of dying, say, based on their age group? That's the thing I want you to keep in mind. Don't be misled. Here you can see you have about a 4 or 5 week increase in weekly cases, but still you're well below your highs back over here. Okay? What about weekly deaths? Look how low these deaths are here. This is a 250 deaths. This is about 125. So you're under 125 deaths per week, all the way back over to here. Okay? Monthly cases, you know, August is up a little bit, but look how much lower your cases still are from back over here. Don't lose sight of that, okay? And what about this? Look at this. 1, 2, 3, 4, 5, 6. You're very close to having a 7 months. You're very close to having a 7th month in a row when your COVID-19 deaths in Sweden have declined. So I'm not sure what you folks are doing, but it certainly is having an impact on your COVID-19, a positive impact on the COVID-19 deaths in Sweden. Thanks so much for your time, Sweden. Again, thanks so much for the 300 subscribers. Thanks for subscribing. Also, thanks for clicking on the share button. Share this video with your friends and family today. We'll catch you Sunday with an updated report.